She's internally preoccupied, is that she's focused within her mind. She has brief episodes of frozen movement where she doesn't move at all. This can happen if she's eating, if she's lying down. Once I saw her stretch, and in the stretch, she froze. And she stayed there 25 minutes. Imagine. And no one can move her. She's there, trapped. Now, this is an extreme example, but this is what the onset of a severe illness really looks like. Now, dance therapy can address this. It's based on the idea that I can use dance as a therapeutic intervention to help a patient integrate her functioning. It's based on the relationship I establish with her and the movement we engender together. That's the core of the experience. The movement itself, well, it has a theme, and the theme is what we address. The theme is what we integrate into the treatment. What we share, the movement we share, is the essence of the transaction. Let's look at her again. I'm going to call her Caroline. She's 19. She's been on the unit 6 weeks, and she's decided last week to come to her first group. The group began very small. That is, there were 6 or 7 of us, and we started with a very small warm-up, moving something like this. And it did not develop quickly. Quite the contrary. All the movement was very slow and small. And I would mirror different patients. This is what we do in our group, in our therapy. We mirror. That is, I try to copy as best I can how someone's moving. I do it a little less intensely so as not to, well, overwhelm what they're doing. And I'm hoping they will feel seen and that they can see how they look like when they move, in the manner in which they're moving. This is how I try to establish some sort of relationship. In this particular warm-up, patients would pick up the movement that I was copying or mirroring from people. They would do that. And when patients pick up a movement and we're all willing to do it, I go with it. I try to develop it because that's where I think the need of the group is finding its expression.